Hello, my name is James Buszkiewicz, and I'm a research investigator in the Department of Epidemiology at the University of Michigan School of Public Health. My current work as a junior investigator within CAsToR has focused on the prevalence of flavored cigar use, sociodemographic disparities in their use, and the role they might play in smoking behavior. Flavored cigars mask the harsh taste of tobacco and may be a key barrier to successful cigar smoking cessation. In addition, flavored cigars have grown in popularity, accounting for 1/3 of cigars consumed. This work is critical to reducing sociodemographic disparities in tobacco-related health outcomes, given that we know cigar use has been linked to increased risk of all-cause and cause-specific mortality. Moreover, flavored cigar use is disproportionately higher in youth, young adults, women, and marginalized communities, such as those identifying as non-Hispanic Black and those individuals with low educational attainment and low incomes. While my work does not directly involve computational modeling, it will inform simulation models being developed by our colleagues at Georgetown University with the goal of understanding the impact of the FDA's proposed ban on all characterizing flavors in cigars, except tobacco, on flavored and unflavored cigar use. Core to my work as a social epidemiologist is the goal of reducing health inequities by addressing key structural determinants, such as income inequity, racism, and the built environment to inform data-driven policy change. While I am new to the field of tobacco regulatory science, I view this work as a logical extension of my prior work in evaluating community-level interventions in public policy. I started my career in public health after receiving my Master of Public Health degree in epidemiology at the Boston University School of Public Health. While in Massachusetts, I had opportunities to work in government at both the local level, with community youth asthma interventions in the city of Cambridge, and at the state level, working on community-level obesity prevention programs to promote healthy eating and active living. I received my PhD in epidemiology at the University of Washington School of Public Health in Seattle. During my time at UW, I was involved in an array of interdisciplinary work, such as examining the impact of raising state minimum wages on health and mental well-being, identifying the influence of measures of the built environment and food environments on body weight trajectories, and evaluating the impact of policy changes in response to COVID-19 on diet quality and food insecurity. I have learned a great deal about the field of tobacco regulatory science since joining the CAsToR project team. I am honored to be a part of such a talented group of researchers with a wide array of training and to have the opportunity to be involved in work that has the potential to lead to consequential policy change. I have three main pieces of advice for those seeking to enter the field of tobacco regulatory science. The first is to keep an open mind on the kinds of research avenues that might be available to you. As someone who is new to the field of tobacco regulatory science myself, I harbored the misconception that we knew all there is to know about the impacts of cigarettes, cigars, and other tobacco products on our health and health behavior. But the reality is there is still so much we don't know, particularly when it comes to evaluating these associations in marginalized or vulnerable populations. Second, check your biases. We are all human, and as such, it is reasonable that before even beginning our research, we may have some preformed thoughts around what we expect to observe when evaluating the association between a particular tobacco product or products and a given health outcome, or the impact of a tobacco policy or regulation on smoking behavior. Acknowledging these biases and setting them aside will serve you well in this work, particularly when evaluating potential unintended consequences of policies and regulations. Lastly, please do not be afraid to ask for help when you have a knowledge gap. The field of tobacco regulatory science is full of researchers with an array of academic training and experience. So chances are that if you lack expertise in a particular area, you can and should turn to your colleagues for help rather than shouldering the knowledge gap alone. And with that, I want to say welcome, thank you so much for stopping by, and thank you for your time and attention.